of my friends yule tulikuwa tunashare na yeye same room, anaitwa Mzee James. Akaona vile huruma ile nilikuwa nikipitia na ile huzuni nilikuwa nikipitia hapo Kenyatta kwa mateso yale nilikuwa ndani. Hakuna mtu anakuja kunivisit. Ndiye akaniambia you can talk to our mom Alice Mongera. Ilibidi sasa nichukue muda nikiwa tu nimelala pale chini, nikamuita mama, nikamwambia mama hebu njoo. Mama akakuja, tukaongea na mama. Alafu mama akaniambia basi tutaona vile tunaenda kukusaidia. Actually they have been so supportive since that day. Alienda sasa wakaitisha MRI. MRI ilikuwa inataka 13,000. Mama wakaleta hizo pesa niende kufanyiwa MRI. Kenyatta wakarudi wakabadilisha tena wakasema hufai kufanyiwa hapa MRI. MRI yako inataka wapi? Nairobi Hospital. 24,000. By that day wameniambia ushinde usikule kitu chochote mchana wote. Usikule kitu chochote mchana wote. Sasa wakati mama wanakuja na pesa wanawaambia hapana, MRI yetu imekufa, haifanyi kazi. Sasa ikabidi sasa after quite some time, kitu kama 1 week nikapewa discharge. Discharge sina mtu wa kunitoa, zimefika 60-70,000. Sina njia yoyote ya kusaidika. Okay. Sasa ndio mama alikuja nikaongea na yeye, mama akaniambia sasa nitafanya nini? Tutaona vile tutakusaidia. Mama ndio walianza kunishughulikia kuanzia pale. Nimetoka Kenyatta, nimekuja nje, ikawa bado niko na problem in the brain. Since that meningitis ilini affect kwa brain kidogo. So ilibidi niambie mama, na mama wakawa tu wanazidi kunishughulikia. Nikabidi nikaambia mama wamenishughulikia, nikafanywa MRI, wakaniambia my brain was nearly to burst. Tulikuwa na some siren usaa ilikuwa ndani ya brain. Kwa hivyo sasa hiyo usaa imepungua. Kwa hivyo saa hizo naweza kusurvive. So since that time they have been so supportive to me. Nashukuru sana.
People don't need to be treated with dignity only because they are sick. Even if people died, they still need to be treated with dignity. There is absolutely no reason why, because somebody has died, should not be treated with dignity. And I guess this will be the new frontier for MMF. We would still want to see, and all of you who have visited City Mortuary, all of you who have visited some of our facilities know with what insult people are treated with. But they are still human beings.
Today marks the birth of Maurice Moses Foundation, a consumer lobby formed to fight for compassionate, quality and affordable healthcare in this country. Today also tragically marks the end of a life. A young man died 2 years ago. This is Maurice, and he died, you know, in the hands of unresponsive health system, after having fought seriously to get quality services in Kenyatta National Hospital, and that was after having come from a private hospital. When you run out of your money, guess what Nairobi hospitals and the private hospitals tell you? The next thing you need to go to is the public hospitals. Am I talking to somebody? When you run out of money, be sure you're not a friend of the private hospitals anymore. A few months earlier, I had lost my husband. Again, coming from a private hospital, we have run out of money, and we ended up in Kenyatta National Hospital. 6 hours at the casualty, waiting for slow coming treatment, and the guy died. You can imagine that is the story of majority of Kenyans. Look at what has happened a few days ago. The Msongari accident that the chairman was talking about. Where did those kids go to? Where were they taken to as first aid? To Meru District Hospital. One reporter sent me a clip of some write-up and said these kids will die of horror. They have never seen a situation, you know, like in this hospital. 2 people sleeping in one bed, others lying on the floor, others naked. I know most of you don't go to these hospitals. But I'll still continue to disturb you with the fact by telling you the fact is that potentially you could be a guest of these hospitals. And what do we want to see when we go there? We want to see better. In the event that we end up in this hospital, you don't want to be another statistic. You don't want to be part of the horror stories we are hearing. Just a couple of weeks ago, you had the story of a lady in Kitui who went through a C-section. And what happened? You know, she went home, many days she's in pain, keeps going back to hospital, they turn her away. Then what happened eventually? She is very, very dead today. There's a poor baby who has been left with a grandmother. And what killed this lady? There was a towel left in her womb. Like somebody told me, God is not in the business of creating women with towels in their stomach. So somebody must have introduced that towel in that stomach. But what do we hear from the authorities? You know, investigations are being done. Guys, fear for yourselves. It is a horror story to be caught up in anything like this. If it does not happen to you, it will happen to your friend, it will happen to your relative. And I know most of you have a story to tell. So what we did, we decided we shall not be silent. And our rallying call for Kenyans is, be silent no more. That is the flagship of this organization. We have heard these stories one too many times for the last many years, but we just walk away. It's not me. It is, you know, it is just a news item. Shall we act when it becomes our story? I am urging all of us to rise up and say no to this impunity. When citizens rise up and say we've had enough, we hate what is happening, but we are also willing to be part of the solution. In the program we call Silent No More, speak out. We are hoping we can build a hospital satisfaction to show the powers that be that things are not okay. They have been told again and again, and they don't act. Like somebody said, the way to show that a stick is crooked, it is to lay a straight stick alongside it. And that is what Maurice Moses Foundation is trying to do. So what is the problem? What is the problem statement? The quality of healthcare services offered in our public hospitals is of exceptionally low standards. The level of negligence and lack of compassion for patients experienced in public hospital is just unbelievably and unjustifiably inhumane. This is perpetuated by unchecked impunity and lack of accountability amongst the professionals in the medical fraternity, and the fact that patients are not aware of their rights. I can challenge all of you, and I know most of the people here are middle class, learned people, but I can challenge you people, you know, to the fact that you don't know your rights as patients. Any of you who knows your rights as a patient? Any of you? None of you. I have talked to the poor, to the middle class, to the high class, and none of them knows that they have rights in hospitals. No wonder we are treated the way we are treated. We take whatever is pushed down our throats because we do not know that we have rights. We do not know that we can ask questions. We do not know that we are the boss. We have let doctors become our bosses. We are taken through unnecessary tests, through unnecessary surgeries, with no apologies to the doctors in the room. You know, I say this confidently because I'm interacting with the citizens, and we should be the ones to give them the scorecard. Isn't that so? We don't know our rights, and I'm challenging you. The time to know your rights is not when you're sick. It's not when you're on that bed. It is now when you're healthy. I would challenge all of you to go to our website. Go even to most of the hospitals' websites. Patients' rights are universal, and most hospitals subscribe to them. But who is teaching you about that? So you have to take the trouble to know what your rights are, ask questions. Don't just take what has been given to you. Seek another opinion before you go for that surgery. If you're not satisfied, ask questions. It's your responsibility to ask questions. It is your responsibility, you know, to let the doctor know that you're not satisfied with what they are saying. So we are running patients' rights seriously across the country. We have been able to translate those rights to Swahili. We have translated them to Kikuyu. We have translated to Kijaluo, Kimasai, Kikalenjin, and we are asking a lot of you people to volunteer to translate these rights so that we are able to get to the grassroots. It's bad in the upcountry hospitals especially. You can imagine if we are treated the way we are treated in Nairobi. What happens to our people in Narok? What happens to our people in Nyeri? What happens to our people in those district hospitals? it is a nightmare story. So we need to get this message out there. So if you know somebody who is able to volunteer to translate the patient's rights for us in any vernacular language, you are welcome. We are also running another program we call Medicine as a Vocation. A lot of times, we did a research in the University of Nairobi sometimes last year, and we were horrified at what is happening there. 70% of the medical students we talked to told us they are doing medicine not because they want to do it. They are doing it because their parents have pushed them to do medicine. Most of you want to be the mothers and fathers of Dr. So-and-so. Dr. Karanja is there, I can see her. We all want to be the mothers and fathers of doctors. But if we are going to push our children to go into things that they are not interested in, no wonder this rot is going to continue in hospitals. Medicine was never meant to be a tool of trade. It was meant to be a vocation. It was meant to be, service to humanity. But tragically, that is not what is happening. A lot of our children are going into it for prestige and for money. This is something that we need to counter. Maurice Moses Foundation has started a program in high schools and university colleges to just sensitize the students on the importance of going into medicine for the right reasons. We are able to be a model of transformation of the health sector. And this can only happen if citizens will also, come on board to be part of this initiative. You're covered by AAR today, you're covered by Resolution Health today, but what happens tomorrow when you cannot afford that cover? You're finished. Where does your mother go to hospital? Where does your auntie, where does your brothers in the village go to hospital? It is in these public hospitals. So as we are running the advocacy programs, we are also looking to do, some tangible things. We are soon rolling out a campaign called Adapt a Dialysis Center. It is a nightmare story when your kidneys fail. And looking at what is happening in the country, the lifestyle illnesses that, are around us, soon a lot of us will be needing kidney transplant, kidney dialysis. So we are soon going to roll out a massive campaign asking you people to support Adapt a Dialysis Center. There is no reason why people should be crisscrossing the country to come to Kenyatta, to go to one referral hospital to get these services. We are able to do this across the country, have dialysis centers across the whole country, and eventually promote them to full diagnostic centers. We shall be calling upon you to support this initiative.